Good morning, everybody. It's a beautiful Friday, morning, and we have a jam-packed presentation today of all the things that are happening. I want to let folks know we have heard you. We got some feedback that you want these recorded, and so we will continue to do that. Last week we had just fewer staff available in the summer, and we didn't record, and we heard from very loudly and clearly that some people will go back and listen to the recording at their leisure. So it's a good accommodation and reminder for us that that's useful. We will also be pulling all of the questions that you're going to see in this presentation into a separate document and revise our after message so you can always see the new questions that are being that we're suggesting you can ask. Please keep your feedback coming because we want to make these as useful as possible for as many people as possible. Okay, let's get into it. First of all, last Friday, I mentioned that Quad Carl was in his last mile coming to the Capitol. And I actually ran to that event after the webinar, and I wanted to let everybody know that it was a really great event. He finished his journey to the Capitol. There were lots of people who joined him to roll up for the last mile up to the Capitol, and it was a great press event. All of the folks that were surrounding Carl were self-advocates and family members. They all had really powerful speeches and great messages, and they weren't canned. They were just ordinary people talking about what was real in their lives. There were some barn burner speeches, I got to be honest, and I was not among them. I was taking pictures, so this was all advocate driven. And there were lots of press people who were there, as well as some legislative staffers and legislators. So it did get attention. It did get a lot of coverage, and you can see Carl's speech he recorded on YouTube in the notes here. So lots of you have been doing all sorts of things since January. This is just another example of another thing that somebody decided to do as a direct action, and so many of you were supporting him as he was coming down, both online with tagging him, I'm with Carl, and doing your own videos, and also, showing up where he was and keeping him company. So a great example of a community effort that was both in person and online. Another exciting thing that happened last week, our friends at the Wisconsin Counties Association came out with their monthly magazine. And one of the articles that they included was an assessment of what the reconciliation bill might mean for counties. Now, a lot of you may know people who either work in county government or maybe are on the county board. Sometimes the county board, because counties do so much in our state, may or may not be aware of how important some of the work counties do is to both Medicaid and SNAP. So this is a really interesting article. I've focused on the SNAP pieces because we have spent a lot of time on the Medicaid pieces, but counties actually have a huge footprint in Medicaid in this state. They run the Children's Long-Term Care Support Program. They do a lot of the behavioral health services are run at the county level, and Medicaid is the highest payer or the biggest payer for those services. Our ADRC friends who administer the functional screen and do options counseling are partially funded by Medicaid for those things. And of course, they have a huge role in helping people apply and renew and figure out not only the Medicaid application process, but other benefit programs that they may be eligible for. And I'm sure many folks in our audience are aware and have worked with either elder benefit specialists or disability benefit specialists who are real experts when it comes to knowing and navigating Social Security and Medicaid and SNAP and multiple programs that some people may be eligible for and need. So this article I thought was particularly interesting because the counties are the workers and the administrators that do the things. And their analysis of what does this mean for us and for SNAP is pretty important. And another piece that you can talk about with your friends or with folks that work in local government. So, we've talked about some of the SNAP changes, and the counties are also identifying many of the same provisions we've been talking about for months, including the additional costs the state will have to pick up if, when the amount of money coming from the feds to actually administer the SNAP program declines. So they're already doing some calculations about, well, if that funding from the federal government declines, what does that mean for our local budgets? Because counties have their own budget. And this County Human Services Association estimated that about $12 million will fall directly to counties to cover if the federal government's when the federal government's footprint in how much it pays to cost the administration of SNAP goes down. Now, that's a big deal because county government's budgets aren't big. They are really, they are budgeting every penny to make it work out. And counties are getting a lot of funding from both the state and the federal government, and then some from local tax revenue to kind of do all of the local services that people are really familiar with. And so as as this reconciliation bill stuff gets implemented, it's important to kind of know the snowball rolls downhill. We've been mostly talking about what does it mean when there's a state budget shortfall, which is important, but there's also a local budget shortfall that happens as well. And counties, there's 72 of them in the state, may make 72 different decisions based on their populations and priorities and just how much funding they have available. They are also pointing out one of the changes in the reconciliation bill would require states that have an error rate that's too high to pay a matching rate to get the federal dollars. Kind of like Medicaid works, right? The state puts in 40% of the costs, and then the federal government gives us 60%, and 40 plus 60 makes 100. This is the same kind of policy mechanism that is now passed into law, where states, if your error rate is too high, have to pony up a certain amount of their own money in order to get the federal dollars. And the Counties Association, is pointing out that currently Wisconsin's SNAP error rate is low, so we wouldn't have to pay the matching rate. However, they're also pointing out that what are being considered errors are really mistakes. They're not fraud. And they would know because they're the ones who are doing the work to administer, the program. And their other piece was, we know the new law at the federal level changes how they count errors. So they are concerned that the error rates will increase, which will make it more likely that you will have a state that doesn't have to pay anything right now in order to get food assistance aid, have to pay quite a bit of state dollars to get that federal money. And there were several other provisions in the bill that we haven't followed that counties are identifying as impacting them directly. The other thing we learned this week, we've talked a little bit about, well, actually quite a bit about the Affordable Care Act marketplaces. And, it's part of the ecosystem in this country of how people get health care. Many people are in Medicaid, and that's a huge payer for healthcare costs. Many people are in the Affordable Care Act marketplace. Many people have employer-sponsored insurance. And the reconciliation bill cuts and changes impact both Medicaid and the ACA marketplace. maybe also Medicare too. A lot of people with disabilities and older adults and care workers and family caregivers are getting their health insurance through the Affordable Care Act marketplace because their employer may not provide insurance, or they've had to reduce their hours part-time and don't get employer-sponsored insurance. There's also a relationship between people who have insurance and Medicaid now. Sometimes they flow when they change jobs up into the marketplace, or somebody changes jobs or their income or their situation changes, and they may flow from private insurance or marketplace into Medicaid. So there is a relationship, and people move between these three sources of ways to pay for healthcare. So advocates had some questions about, well, maybe we need to understand a little bit more about who is in the marketplace in Wisconsin, because if you are a low-income person, and many people are in the Affordable Care Act marketplace, about nationally, about half of the folks who are getting their insurance through the ACA marketplace are below 150% of the poverty level. So it's like, maybe that would be good to know, is like, because those lower income folks are probably more at risk of not being able to afford their current plans if the price for those plans goes up, right? And then they either will have to decrease their income and go into Medicaid to keep covered, or they might become uninsured. It seems kind of logical that if you have a low-income group of people who's not able to keep paying the same amount or more, then they have to go somewhere else. So we asked our friends at the Office of Commissioner of Insurance, who is the state agency that kind of oversees Wisconsin's Affordable Care Act marketplace, for some numbers. And they were able to point us to Wisconsin doesn't have its own marketplace exchange, so we use the federal exchange. Anybody who is signing up for a marketplace goes through the federal exchange, and they pointed us to some numbers that are available with our friends at CMS. So now we know a little bit more about who's in the marketplace. We have more than 300,000 people in Wisconsin who have marketplace plans. And importantly, about 30% of them are older adults between 55 and 64. Why do I say that's importantly? Because older adults tend to have more healthcare needs and might be higher cost. And the way the marketplace premiums stay lower is by having many people who are healthy in the marketplace to offset all of the folks that may have higher costs. So in other words, the more people you have in the marketplace pool, you want many of them to not have many high cost services needed, to make sure that you can pay for, you have enough income from premiums and other things to pay for the people who need care. And generally, the older your insurance pool or the more healthcare needs it has, then the more likely it is that you have higher premiums. And also, the theory goes, the more likely it is that people who are younger and lower cost may not be able to afford their insurance and leave the pool, and then the costs for the whole pool go up again, because you're getting more and more folks who are higher cost concentrated in the pool. So out of that 313,000 people, more than 100,000 are in an age bracket where you would expect higher healthcare costs. 30% of the marketplace enrollees are in rural parts of the state, which also tend to have fewer healthcare access options. Also important is almost 80% of the folks in marketplace are under 400% of the federal poverty level. And that's important because the reconciliation bill makes some changes so that people under 400% of the poverty level who perhaps miscalculate how much their income is will have to pay more if they get it wrong, if they get more tax credits than they're supposed to. The impact from the reconciliation bill starts if you're at 400% of the poverty level and lower. There are also a ton of people, almost a third again, who are currently paying premiums of $10 or less because we have the subsidies that were not extended in the reconciliation bill and are set to expire at the end of the year. So right now, about a third of our marketplace in Wisconsin have fairly low premiums based on their incomes and based on the existing subsidies that are going to go away unless Congress acts at the end of this year. And there are quite a few people who are, again, not quite a third, but probably 25% who are in the marketplace earning 150% of the poverty level. And more importantly, for our state, there's almost 60,000 people who are earning between 100% and 138% of the federal poverty level. Now, why is that of particular interest? In other states that expanded Medicaid coverage under the Affordable Care Act, that group of people, those 60,000 people, would be insured under Medicaid. That's not true in Wisconsin. We cover people in Medicaid up to 100% of the federal poverty level if you are in the expansion population. But if you're above that income, your place to get insurance becomes the marketplace. So that's a group of people that really is already very low income, maybe part of the group of people who is paying relatively low amounts for their premiums because of the subsidies. And as the costs of the plans go up, or the plans change and become less valuable, and the subsidies go away, those are the people we think are most at risk of either having to move down into Medicaid to keep care or going uninsured. And we've talked in these sessions before, over the last several weeks, there has been kind of growing coverage that many of the insurers are planning to raise rates. And a good portion of those insurers are saying they need to raise rates, not only because healthcare costs are higher, they're always higher, and I've never seen them go down. They're also saying the policy changes that are in the reconciliation bill and the expiration of subsidies, and to a smaller degree, the new tariffs that are being put in place for imports from other countries, and specifically on pharmaceutical drugs, are all reasons that there's a lot of uncertainty as to how much it's going to cost, and they want to raise the rates on premium holders to make sure they have enough money to cover what they think the cost of care is going to be. So KFF, Kaiser Health News, is tracking, what are the rate filings that insurers are doing across the country. And they're doing it by state. And our friends at the Office of Commissioner of Insurance are getting these rate filings. I copied what the filings are that from KFF for Wisconsin. So you can see that there are many plans and that are planning to increase their rates by a wide range. And some of those plans may be increasing their rates more because of the age or the area they serve, right? But I think the lowest rate increase is almost 7%. Across the country, the average rate increase is about 18%. And there are rate increases that in some parts of the country are as high as 50% increases. We're not going to know what the final rates are until the fall, but this is something to watch, because obviously if the rates for premiums are increased, that is definitely going to impact people who are current marketplace enrollees. The other impact that we haven't talked as much about is the state reinsurance plan. And that it helps try and keep premiums low at the state level. It pays insurers part of high cost claims. And that program is, again, funded with a combination of both state and federal money. What is reinsurance? It's supposed to help lower the risk to insurers of high cost claims, and kind of as a buffer, right? To make sure that they don't have to keep raising rates for premiums more and more and more because they're worried they may have a few high cost claims that will drive the overall cost up for everyone. So this is kind of a buffer that the state has to keep premiums even. Well, based on some of the concerns people have about if the marketplace premiums go too high and people can't afford that insurance, if people end up saying we are not going to participate in the marketplace anymore, either because they're moving to Medicaid or they're going uninsured, again, that relationship between fewer, younger, healthier people who provide funding that covers the cost for the folks who need care, that will mean that there are likely more people with higher cost claims, and it could drive, again, the cost to the state up to maintain the reinsurance rate. That sounds really complicated. Here's the deal. If too many people can't afford their healthcare plans in the marketplace and leave, that means there's unexpected state costs that we aren't aware of that could create another state budget hole. A few other things to think about as we are in the August recess. Last week, I shared that there was a 5-page memo that went out from the Republican National Coordinating Committee that was telling Republican members how to market the reconciliation bill, and specifically how to talk about Medicaid, and specifically to make the claim that the $1 trillion in cuts to Medicaid were actually going to strengthen the program and not hurt anyone, essentially. We've been asking, and you've been asking questions of your lawmakers throughout this process. And when we were talking to some of our grassroots this week, we said, the questions you're asking lawmakers are actually the right questions to be asking the general public, your neighbors and the public, because they're common sense. And they really help illustrate all of the things that are unclear and all of the ways that the reconciliation bill could end up creating real pitfalls for ordinary people. The idea of, do I qualify for a caregiver exemption? What is caregiving? Is the person I'm caregiving for disabled enough that I can qualify for the exemption? How much caregiving do I have to do? All of those things are very reasonable questions that everybody can understand. And perhaps the audience for those questions is not only lawmakers, it's also everyone you know. Because how those questions are answered is really going to determine the difference between somebody being able to keep their health care maybe or not. And that's pretty high stakes. And I think there are lots of folks who kind of understand there's something in a bill somewhere, but don't do the work of figuring out, how does that actually work in real life? How does that work in practice? Like our counties have to do, because those are the folks who end up having to make it work and figure out, well, what documentation do you need? All of those things. And I think the more that we can be clear with everyone who is maybe hearing a message from lawmakers that they would like folks to believe that there is really another side of this, where this bill is creating all sorts of real world problems that could mean people are either left out of an exemption, or that people who are working and should be eligible are going to fall through the cracks, even if they're meeting the requirements. We also got some feedback about, hey, maybe it's time to do some more opinion pieces with local papers. I think it's a great idea. Again, and we have kind of two different strategies here. You can use any of the language that you see on this slide. We just got punchy at the keyboard and threw something together. This one was more about addressing a specific concern about fraud, waste, and abuse. I do think it's important to continue questioning lawmakers and holding them accountable for their choices, but this op-eds are a great way to kind of get at members of the general public who may be hearing messages from lawmakers that really aren't matching what the reality is. So you can focus on aspects of the reconciliation bill and talk about it from an individual perspective. The other thing that we heard, and I actually think this is really important, is a lot of grassroots folks are saying, hey, you know, it isn't only Medicaid that I'm worried about. It's all of these other things that are being changed or cut at the same time. And all of those things together make me feel like my life is a lot less stable and certain than it was before. So here's again another frame that you can use. And I think that there are many low-income adults and many low-income people with disabilities who are their budgets are fixed and costs are going up, and they don't have any flexibility in their budget to make up for those rising costs. At the same time, that some of the things that they really rely on to cover some of their costs, like Medicaid, like food assistance, like potentially housing vouchers, are being either cut or reduced. So you can think about that if you have clients or if this fits your family, and kind of adjust, you know, how you talk about these things. And if you don't want to send it to your letter to the editor, you can send it, you know, this is a perfect exercise for you to do for yourself and do on social media or do a video. Like there's lots of ways to think about, you know, how do these cuts collectively impact you. I did an interview on Wisconsin Public Radio on Monday, and it was about the executive order on homelessness that came out last week. But I'm including it here because as you're talking about the many different things that are happening at the federal level, I think it's a good way, a good example of tying together how all of these different changes are impacting the same groups of people. So, you know, maybe this isn't your issue, but the reporters were certainly asking about, hey, these folks that are more likely to become homeless are low income. And we've heard about these other cuts to Medicaid and SNAP. Are the same people getting impacted? And the answer is yes. So this is an article that you can look at as an example of, you know, how to tie together all of these different changes and show that they are impacting you know, people with disabilities or older adults, or, you know, folks that are already having a harder time because they don't have the income, or they rely on programs that require them to have a low income. We're still doing our survey. We've now got a goal. We want 1,000 responses. We're 20% there. We have gotten some questions about when is the deadline? It's not fixed. However, we are thinking about the fall as being the right time to reveal the results. So if you have newsletters or email lists or meetings coming up with local groups or clients, you can feel free to include the survey link in any emails or newsletters you have through August and September, and keep bringing it up so that more and more people take the survey. We're hoping for 1,000 responses across the state. I think we're over 200 right now. So not bad for a week's work. All right, what is Congress doing? So we're moving along the timeline here. And next week is August 15th, which is 45 days before the end of the fiscal year. We've talked a little bit about pocket rescissions and whether or not the administration's Office of Budget Management Director will try that tactic. We'll know by next week, Friday. The House and the Senate now are on recess. We're going to cover what they did before they left. We've also talked about how August recess is being used to kind of sell the reconciliation bill. You may have seen that one of our congressional reps, Representative Stile, had a couple of town halls, and there were lots of people who were not happy with the reconciliation bill there. There are also a number of our representatives who are very carefully or kind of doing things while they're in town, but they're not holding public town halls. They're going to specific businesses or places and may not be having a forum where anyone can provide input. Part of what they're selling, in addition to the cuts that happen to Medicaid, are actually going to strengthen the program, which is not true, and it won't hurt people, which is also not true, is they're trying to sell the idea that this bill didn't cost that much. So they changed how they counted the money, essentially. And they're trying to make it seem like the bill didn't create as big of a deficit as it did. The normal way of calculating the cost of continuing to not collect the revenue, right? That when we talk about tax cuts, you're really talking about we're not going to collect money coming into the government. We're going to let people, let businesses or other things keep that money and never take it in. That there is a cost to that. And normal accounting practices says, well, if you decided not to do those things, then you would have more money coming into the government you could use for, and so they reflect that in their calculations, that there is a cost to continuing to not collect that money. Using the normal way of calculating that cost, the bill creates an additional $4.5 trillion added to the deficit. That's how much money we're not taking in and how much more money we're spending. And the gap is $4.5 trillion. But they decided to count it a little differently and make it seem like the current policy of not collecting as much revenue as they could is a zero cost. And in that way, the number changes to 715 billion. That's a lot less. So part of the selling tactic now is we're going to try and say that it's a huge tax cut. Tax cut meaning we extended the language that makes it so there's less money coming in. And we're also going to claim that there's no cost to that. So part of what they're now also selling is this idea that everything they did didn't really cost anything. At the same time, they're trying to say that all of the big cuts they made to Medicaid and healthcare aren't going to matter, to harm anyone. I'm going to go through very quickly, but we have included different questions at certain points in the presentation that you might ask, based on some of the things that are happening. So this is one that kind of asks about that relationship. If you're saying tax cuts cost nothing, what about the cost of cutting this amount of money from Medicaid, the Children's Health Insurance Program, the Marketplace, and SNAP? You did something, so there should be some if you did something, there should be a reaction to that. There are a few Republican lawmakers who are holding town halls. And I think it's important to know that we saw this with Democrats, actually, when the Affordable Care Act was under consideration. That there were lots of people who showed up to town halls and they weren't happy. And they said why they weren't happy. And then those people were dismissed as being folks that didn't agree with me anyway and somehow not mattering. We're seeing the same pattern repeat right now, that Republicans who are having town halls are trying to say that the complaints they are hearing are only coming from Democrats or groups that are aligned with them, and that somehow the anger that is being expressed is not really reflecting the opinions of their constituents. And that maybe some of those people who are complaining are there for partisan reasons or are paid to be there. So just something to be aware of is there does seem to be this idea that if you are saying something that is not what that member might agree with, it is not confirming the message that they're trying to send, they may be writing that off or dismissing it as, well, you are a person that doesn't agree and you're, that I don't have to pay attention to you. That is incorrect. Members of Congress do actually represent all people living within the bounds of their district. And there's enough people that live within the bounds of every district that not everybody agrees about everything. So even if you're a person who lives in a district where many people maybe share the opinion of your legislator, that doesn't make your opinion less valid. And it doesn't mean that your legislator should be ignoring you about it. It means they should be taking into consideration when they're hearing from lots of people who aren't happy with choices that they've made. They should be thinking about that as maybe that represents a lot more folks in my district than I'm hearing from. Okay, moving to the 2026 federal budget. Now the House and the Senate are both on August recess. The House committees have mostly held what are called markup hearings. It's where we see the first draft of the budget and the committee has the opportunity to ask questions, etc. The House committee has made progress on most of the 12 appropriation bills that are part of the federal budget. However, it said it's not going to hold its markup hearing on the labor, health, and education appropriation bill until late September. That's important because that's actually the bill that has the most stuff in it that people with disabilities pay attention to a lot of times. And it's also the largest bill for non-military spending. So, funding the Department of Health and Human Services, that's a huge department that does many, many things and lots of expensive things. And, labor and education also do a lot of work that is directly tied to people with disabilities and older adults. So leaving the biggest bill to the end is kind of saying that maybe there's more controversy or less agreement about what should be in that bill than maybe other places that got done earlier. And the other piece is, if you're not doing it until late September, remember the fiscal year ends September 30th. So the House is really saying we're leaving the biggest bill where there might be less agreement until the very end and not leaving ourselves a lot of time to do it before the end of the fiscal year. The Senate subcommittee also released its version of the labor health education bill last week. So we're going to see, the Senate completed their work on that bill. The House is saying it's not going to start until late September. Again, like with any piece of legislation, the House and Senate have to agree to the same language. So you could have very different ideas in the House and the Senate, and you could like one, the Senate version and maybe not the House version, and somehow they have to potentially take very different bills and come to some agreement about what should be in them. The other piece that is important is the administration, unlike other administrations, has been very willing to withhold money or take money that has been asked Congress to unappropriate money that they agreed to spend. So that's another wrinkle in this particular cycle that we haven't had before. We do know that both the House and the Senate have put together a budget for transportation and HUD, which is Housing and Urban Development, and they have not funded HUD to the level to keep up with rising housing costs. So there was an analysis put out last week that says, hey, perhaps not everything that was in the president's budget is going to end up in the Congress's version of the budget, but by not increasing the funding levels for housing vouchers, it means fewer people are going to be able to get housing vouchers. And you can see that there's a difference between the House bill and the Senate bill that really determines how many fewer people are probably going to end up with housing vouchers. The House bill also has a couple of policy changes that are important. Right now, people can't be charged, who with housing vouchers can't be charged more than 30% of their income for rent. And that bill, the House bill, would change that. It would let states and local agencies raise rents for people who receive vouchers without any limits. And certainly this analysis says, hey, if you're not providing extra funding to reflect the actual housing costs, agencies are either going to raise the rents significantly on low-income people who can't afford to pay them, or they're going to say we can't serve as many people who have housing vouchers, and it'll be harder for people who get a housing voucher to find a place that will take it and use it. The Senate bill does not do that. It again it increases funding, but not at the level needed to keep serving the same number of people. So for those of you who know people, and there are many older adults and people with disabilities who use housing vouchers, this is a sign that those programs are also going to be potentially impacted by the federal budget, and that they may not be there may not be as many vouchers available, and there may be fewer places that will take them, and it may not protect you from rising costs as much. So what did the U.S. Senate committee put in the health and labor and education budget? This is actually kind of sort of good news. And I'm gonna put a little asterisk by it. The committee, first of all, funded all of the disability, aging, and education programs the same or more as it did last year. So that's a clear sign that the Senate committee's intent is not to cut those things. The other interesting thing is that it does not recognize or make any changes to, the structure that they think exists. You may remember in spring, we've been following various staffing cuts that agencies have been making, and also reorganization plans that have been out there. Interestingly, this particular budget is just assuming that none of those things that have occurred have happened, which again is seen as a sign by some watchers that Congress is kind of subtly saying, like, look, you have to come to us to actually reorganize and do the things that you've already done. They've also been very specific in their committee report about the exact funding amounts for each individual program. And there's some interesting language about wanting reports coming back from agencies or specific budget tables that itemize all of the amounts to make sure that the money that Congress is intending to spend actually gets to the specific places that they are appropriating it to. And it's just an interesting way of structuring this. Now, the committee report doesn't have the force of law, but it is a very clear communication of congressional intent. This committee, passed this version of this particular appropriation bill. The full US Senate hasn't agreed to it yet, and the House may have very different ideas, but still, it's in the best position we can be at to see, the programs that we care about in aging and disability world named with the same or increased amounts of funding next to their names. That is not Congress saying we think these things should be cut. It's saying we think these things are important and should be funded at least the same level or higher. So a question you could ask for Congress is to, make sure that they're aware of what this committee has done and that there are some things in there that you support. It's still relevant to make sure you're asking questions about how is Congress going to guarantee that the administration is going to do what Congress has said. And it's also true that the Senate and the House may or may not agree in time to pass the budget by September 30th, which puts us in a position where they either have to pass a continuing resolution to keep money flowing, or they have to shut down, or they will shut down the government, or they will do some combination where they will pass funding for the whole next year for certain things while they continue to negotiate and argue about stuff that isn't settled yet. So this is a kind of nerd question, but if they don't get the budget on time, and that has been the pattern for 20 years, and they are passing a continuing resolution while they're working on the final 2026 budget, it will become really important that that continuing resolution includes all the itemized amounts for each program to make sure that the administration actually spends the specific amount of money given to those programs. Every member of Congress will have to vote on the federal budget. There are some members that have roles on the committees that are doing the big work on the budget. And some of our members are on the appropriations committees in the House and the Senate. But every person will have to vote on the budget. So keep that in mind as September comes through. We've talked about pocket rescissions before. And there's a little primer that isn't quite plain language, but close on what is a pocket rescission. Essentially, the idea is that our Office of Management and Budget Director, who works for the president, has been withholding money that was supposed to go to a variety of places. And that money has not flowed to states and to the groups that were supposed to receive it. We're now 10 months in to the federal fiscal year, and there's still been no money released for some of the things that Congress authorized funding for, in March 14th. When they passed the last continuing resolution. The theory the OMB director has is if I hold the money until 45 days before the end of the fiscal year, which is August 15th, next week, Friday, then I can stop spending. I don't have to spend that money. And whether or not Congress decides to, I can submit to Congress that I want them to not spend the money in a rescissions request, but the law allows me to pause the funding and I never have to release it, no matter what Congress does. That is the idea that is being floated, which would essentially mean the administration has taken it upon themselves to withhold money Congress has appropriated and simply not spend it until the clock runs out on when the funding is valid. There are starting to be some grumblings over the last couple of weeks that Congress doesn't really like that idea too much. They're uncomfortable with it, and they don't want to do more rescissions requests. Remember, they passed a big one that 2 weeks ago that removed funding from some U.S. aid programs as well as national public radio and television. So they've done a rescissions bill already. And the idea was, well, the administration was going to introduce a lot more of them. Congress is saying, we don't really want you to do that. And certainly Democratic members have said, well, if you've gone back on promises you made to fund things that we Democrats and Republicans agreed on, then why should we negotiate with you on a future budget if all you're going to do is decide there are parts of spending that you're going to take back and get rid of anyway. So I think that there's at least rumblings about we don't want to do more rescissions packages, especially as we're negotiating on the 2026 budget. Notice that some Republican senators didn't quite close the door. Like, well, rescission requests might be okay if it's if you take it to the appropriation committee and if they're on items where there's waste, fraud, and abuse. But that may not be enough to change the mind of the Office of Management and Budget Director, who is consistently saying, yes, I want to use pocket rescissions as soon as next week. So by next week, we will understand whether or not the OMB director has made those requests, and whether they have responded to Congress being uncomfortable and decided not to do that. Regardless of whether or not rescission requests are made, the fact is the administration has held back funding and it's never gotten to the places it was supposed to go by the end of the fiscal year, and Congress hasn't really done a whole lot about most of that spending. So effectively, there are definitely things that Congress said we should spend money on that have not received money. There's also been continual talk about should we do another reconciliation bill, which again is a special process that requires a simple majority in the Senate to pass instead of 60 votes. So this week there were a couple of briefings on ideas about what could be included in a second reconciliation bill. I've pasted the address, the website of one of the places that was invited to present. And there have been two events this week that are talking about ideas. Certainly there are some ideas of a separate healthcare bill that might not be part of a reconciliation bill at the end of the year. None of those things are solid, but it's important for us to know that the 2026 budget is a big thing that could have more cuts in it to things we care about, but there's also additional legislation or reconciliation that could happen this fall that is separate from that budget process that again could make more changes. The administration is also continuing to do things in a variety of areas. This article came out this week and is really kind of assessing a whole web of comments that our current U.S. Department of Health and Human Services Secretary and leaders within that department have been saying. And we've covered some of this over the spring. I don't think these are maybe new ideas or new things, but it is showing a pattern of connection with people with disability or chronic illness being the fault or responsibility of individuals or outside factors. And that's important in the sense that some of the attitudes toward disability have really focused on prevention or have blamed specific actions or people for causing disability. And none of those things actually help people with disabilities or families live the lives that they want. They don't address, they are approaching disability from the perspective of this is something that needs to be avoided or prevented at all costs, as opposed to this is something that happens to individuals for a variety of reasons and is a natural part of the human experience. And what we should do is try and think of ways to make it as easy as possible for people to do, have as many opportunities as possible as anyone else. Some years ago, you might remember that there was a lot of blaming, especially of moms, for causing autism. This is not a new idea or a new necessarily attitude, but it is new that we have so many people in leadership positions who kind of agree with these old and outdated ideas that are not particularly helpful to people who are who have chronic conditions or disability. This week, a new nominee had a hearing for the Administration of Children and Families, and within the Department of Health and Human Services. This person is important in the sense that under the idea that the Department of Health and Human Services has on how to reorganize itself, the Administration for Community Living, which contains all of the disability and aging programs, would be moved under the Administration of Children and Families, which would be renamed to the Administration of Children and Families and Communities. So this person is important in the sense that if that reorganization happens, and remember, most of the ACL staff is already gone. This is the person who would be in charge of not only all of the things that impact foster folks, but disability and aging. And he is from Idaho. He's a pharmacist by training and his first couple of jobs, and has been the director for the Idaho Department of Health and Welfare for a little over a year, and prior to that was the budget director for Idaho's governor. Some advocates have been pleased with some of his reforms of foster care, but disability advocates have raised some concerns because the reforms that have been applied to foster care kids in Idaho seem to have opened up a loophole for those kids who have intellectual and developmental disabilities. And it seems that the exception is kind of been the rule, and that many of the foster kids with IDD are going into segregated for-profit group homes, as opposed to some of what happens to kids in foster care who do not have IDD. He's also been criticized by disability advocates for ending an Idaho program that allowed people to be paid as caregivers for their children. That program was in response to a critical shortage of care workers, which affects every state, not just Idaho. And it's worth knowing that Idaho's home and community-based long-term care system was found so lacking that it's forcing people into institutional care. So there have been a number of disability advocates who have been concerned that this nomination really really is perhaps not the direction, is a departure from the direction that we've seen for people with disabilities in the past. And you know, he may be a person that is in charge of far more federally funded disability programs in the future. There's also some movement, you know, many federal agencies administer programs, and states can ask for permission to run those programs in a certain way. That's certainly true for Medicaid. Every time you hear the term Medicaid waiver, that waiver is a reference to our state asking permission to the Centers for Medicaid Services to do things a certain way. Other federal agencies have a similar relationship. And the Department of Agriculture manages the SNAP program. And if states want to do things different with their SNAP program, that's who they ask for permission, is the Department of Agriculture. This is, again, another sign that certain policies states want to do that have not been allowed before are now being allowed. And there are many states that are now asking for waivers to control or restrict the kinds of foods that people who receive food assistance can buy. And in some ways, this is also an old idea. I remember testifying against a bill a decade ago that was very similar in its tone. The bill wanted to not allow people to use their SNAP benefits to purchase certain kinds of foods. And in some ways, I would like people who have SNAP benefits to be able to purchase, healthy food. And many people who have SNAP benefits probably want to purchase healthy food too. But there are two things that make this kind of proposal a little bit alarming. The first of all is it doesn't recognize that lots of people who rely on food assistance don't have access to healthy foods because they live in places where there isn't much supply, or they're living in situations where they really need shelf-stable foods. Maybe the only cooking device they have is a microwave or something to that effect. It also doesn't recognize that sometimes healthier or fresh foods that don't keep as long are more expensive. So if you have the same amount of food benefit and you end up having to spend it on fewer things that are higher cost, ultimately that means you get less food. And for folks who are really trying to stretch every dollar and make sure they have enough calories to stay full, maybe that drives some of the choices. The other piece is there's an idea of, if you are in a certain program, decision makers who do not have lives that look like yours have patriarchal is the word, but I'm trying to find a different way of saying it. They think they can make decisions for people who are in these programs because they either believe people who are in these programs are not capable of making those decisions, or that they should be doing different things than they are. And that is often, those folks are often making those policy decisions based on their reality, which is not the same as the people who are in the programs. So again, it's another example of somebody thinks they know better than the person with the lived experience and is trying to dictate and make decisions for that individual in a way that really restricts what they can spend money on. Also, grocers hate this because they have to figure out if somebody is using SNAP benefits, if they're buying a food that is approved or not. And that's difficult administratively. We've talked a little bit about tariffs. Yesterday, there was a set of tariffs that went into effect for most countries of 10%. we've specifically been talking about tariffs on pharmaceutical and imported drugs. Remember, drugs are something that Medicaid and a lot of people with chronic conditions use, and a good portion of the drugs that are used in this country rely on an international supply chain, both generic and brand name prescriptions. So, again, tariffs are in the news, and specifically on pharmaceutical drugs, and that is another factor in why insurers are nervous about how much it will cost to provide health care, because if the costs of drugs go up because of tariffs, you have to build that in to your insurance or your Medicaid or Medicare budgets. There's also been some comments made by administration officials that are referencing privatization of Social Security, and thinking about the new provision in the reconciliation bill, and that would give newborns a $1,000 savings account as a way to move down that path of privatizing Social Security. So that's new. Meanwhile, it seems like there is a proposal that's not quite out yet that could again change how much people who are already in Social Security get in terms of benefits. We've seen this approach in a couple of different places, that that changing what is considered public assistance then has a ripple effect down the line. This is another example of that. Currently, people who receive SSI don't have benefits reduced if they live in households that receive SNAP. And the change that they look like they're proposing to do is to not consider SNAP public assistance, really going back to a 1980 policy. And what it could result in is that lots of people who receive SSI now could have their monthly benefits reduced, especially if they live with other people who the government expects are providing some sort of in-kind support and maintenance. So we'll stay tuned on that. There are lots of articles that continue to come out about the impact of the reconciliation bill. I won't go through all of them, but if you're looking for a timeline on implementation, there is a nice one out there. There's an interesting article that kind of goes into some history if you really want a weekend read. And I think it's relevant here because it does go into this, like when we hear lawmakers say, hey, we've cut $1 trillion to Medicaid, but we don't think it will cause harm. This may be some of the rationale behind that. This idea that people earn health care by working, and that health care coverage isn't necessarily correlated with being healthy, are two things that I think really are part of the base of why there is a belief that if people lose Medicaid, maybe that's not such a big deal. I think we would say something different, but that article is out there. There's also a number of opinion pieces talking about various populations of people that rely on Medicaid. This is a neat piece about what that specific reduction in retroactive coverage could mean. This one is about new moms, but for those of you who work with people, older adults, or people who are in traumatic injuries where all of a sudden something happens and there is, a big medical intervention that happens, I think those are two populations of people that would also be impacted by less retroactive coverage in the same ways. And then I won't talk about this one too much, but certainly we have lots of families. This article was framed about really about Katie Beckett and the importance of Medicaid to families who have children with special health care needs or illnesses. So again, if you know people who are in that situation, that is a story that is being elevated as well. And with that, I am going to stop because we've been going on a lot and there's so many articles that we can't go through them all.
All right. There were a couple questions, but it's going to take